IUI is intrauterine insemination. It's one of the less complicated ways to assist a couple to have a baby. However, there are certain prerequisites. For a couple to be suitable for IUI, there must be sperm, adequate sperm. There must be patent tubes, i.e. the fallopian tubes that you have should not be blocked, at least one of them. And the third thing is that we would need to help you to ovulate at the precise window of opportunity. And that's when ovulation induction comes in. So what do we do? The couple comes and see us, again on the second day of the period, whereby we use either oral ovulation induction agents like clomiphene or Femara. We may add in some injections along the way. This is what we call a stimulated IUI cycle, a stimulated intrauterine insemination cycle. The patient is brought back for another scan. A pelvic ultrasound is done around the 8th day or the 9th day of a period, looking at the size and development of the follicle. We may add more injections along the way to help to nurture these follicles to reach the correct diameter, and that would again be about 18 to 20 millimeters. Most of the time you will reach that size after about 11 to 12 days of stimulation. Having ascertained that the follicles have reached the right size, and another thing is the lining of the womb, which is the endometrium. So having reached the right thickness from the endometrium, we would tell the patient that it's time for us to trigger the ovulation. This is normally done 36 to 40 hours before the expected time of ovulation, and also that's the time when the husband is needed to produce a sample. So that's his role to play. Simple but very important. So we need him to produce the sample. It will be passed to our scientists in the laboratory, where we do a spinning process in a centrifuge. What that means is that the sperm will be processed, where the most motile sperms will be used for the insemination. By doing this spinning, you actually get rid of a lot of debris, you get rid of the abnormal sperms, you make yourself a more motile army of sperms that may help you achieve your desire to have a child. So having done that, and having ascertained the window of opportunity, we will take the processed sperm in a very tiny, soft catheter. Alright, we'll use that to inseminate the processed sperm into the uterus. Hence, you can clearly see there are a few advantages of intrauterine insemination. Number one, the window of opportunity is clearly defined. We know when it is. Number two, we get faster, more motile sperms that will be used. And thirdly, we inseminate this sperm much closer to the egg than you would have from natural intercourse. So these three theoretical advantages makes IUI a very viable option for couples that are suitable.